But today we have with us Dr. Susheel Kharbanda, and he's practicing in Delhi NCR. Today we're going to be talking about kidney stone management. So, very welcome.
Hi, thank you.
Well, the very first question which comes to my mind when it comes to kidney stone, that what are the indicative symptoms so as to make sure of a person that he might be having a kidney stone and he should rush to the nearest urologist?
Yeah, it's a very good question actually. Kidney stones can happen in your kidneys, in ureter. There is a pipe from which comes from kidney to our bladder, urinary bladder. So your kidney stone can form in your kidney, one in ureter, urinary bladder, and urethra. So they can give you symptoms as per their position. If they are in kidney, they will most probably they will give you pain in your flank areas. They can give you blood in urine, that is called as a hematuria, or they can give you any infective symptoms like fever, chills and rigors. If stones are there in your ureter, they will give you extreme pain. That is, you can from flank to lower abdomen, from to up to your penis or urethra, what you say. And again, it can also give rise to your fever with chills and rigors, and it can also give rise to blood in urine, that you call as a hematuria. Now, other if the stones are either in your urethra or in bladder, they can come as a pain while passing urine. They can come like again blood in urine. Again, they come into the retention. That means they are not able to pass urine. So if you had a symptoms like pain, if you have a symptoms like passing blood in urine, if you have a symptoms like severe fever with chills and rigors, at that time you should consult a urologist.
Well, why do you think the number of cases when it comes to kidney stone is on a constant rise these days?
There are plenty of reasons behind that. One thing is our dietary reasons. We are not taking enough water, and second thing, whatsoever we are consuming, that makes a lot of sense. We are not taking proper diet, healthy diets. We are consuming more and more oxalate rich diets. We are not taking healthy diets which are having more fruit, more fluids, and we are not taking enough fluids. People who are actually, what happened, people nowadays are working in a closed environment where the AC culture is there, and that you are not feeling thirsty. That's why you are not taking enough amount of fluids. So that's why this is the main reason behind it, why uh, why the kidney stones are increasing.
And also would like to know what makes it very important for a patient to make sure that the stone get diagnosed at an early stage. Why it is very important? What complication can rise if it is delaying?
See, if you had a kidney stones, one thing, if any kidney, most importantly, there are two reasons behind to get your kidney stone to be managed either by surgically or medically. One is your symptoms. So symptoms in a form of pain, hematuria, difficulty in passing urine, retention of urine and all. And second, most importantly, which people tend to forget, is if the kidney stones are stuck up somewhere and those stones are obstructing your urine, that will cause your failure of that kidney. I tell you, in my clinical practice, in a year or so, I have to do nephrectomies, around 15 to 20 nephrectomies a year, that are just due to stone disease. And one more thing that is more important is what happens once a patient has a symptom of pain or something, hematuria or something. He took some medicine, he had diagnosed of stone, but he took some medicine, now his symptoms are gone, and they just forgot about their stone and all. What happened? The symptoms are gone, but that stone is still there, and it's keep on damaging your kidneys. So that is the main reason behind it. You should not forget that you have a stone, and you should take your proper treatment for the stone.
We have also heard of many misconceptions and myths when it comes to kidney stones. So would you like to break any of them?
Yeah. One main myth is taking beer, isn't it?
Yeah.
Taking beer will push your stone out. Actually, beer doesn't contain like grease or something that will push your stone out or something like that. 1 liter of beer is equivalent to your 1 liter of water. Only thing is who is habitual of taking beer, for them consuming 2 bottles of water, I don't think he will be taking in a very in a short period. If you ask somebody to drink 2 bottles of water, I don't think that is easier. But somebody is habitual of having beer, to 2 bottles he can have. Okay, so 2 bottles of beer will work as good as 2 bottles of water. So if you take water also, that will also work as a beer. So what happened? There is a, it's just, you can see it's a tube where some stone is stuck up. You have to push, make the water pressure so that it come out.
Yes.
Okay. So beer does the same as the water does.
So it's better to stay away from
Yeah,
alcohol.
of course. And one more thing, beer contains a lot of uric acid, and uric acid, if you keep on having beer for the longer time, and as beer has having uric acid, so there are more chances that in future you will be forming a stone.
Of uric stone.
Yeah, uric acid and oxalate also.
Well, that was amazing talking to you. Thank you so much for your insights. We are very, very glad to have you with us.
Thank you.